I am Meredith Addison, and I am a staff nurse at Regional Hospital in Terre Haute, Indiana. My husband and I went to a National Emergency Nurses Association conference. And while we were wandering around the different booths, we came across this thing called Morgan Lens and met the people whose family were responsible for creating the Morgan Lens and just couldn't believe it. Okay, the Morgan Lens is just a see-through, clear, large, oversized contact lens with an IV tubing attached to it. And all you do is just put a little something in the person's eyes to numb it just a little bit, slip this lens underneath their eyelids, attach it to the irrigating fluid, and stand back and let it take care of the problem. It's just amazing. We use Morgan Lens most often for a splash where they get something in their eye and it has to be irrigated out, and the eye will spasm and you cannot get them to open their eye. And so you put a little numbing solution in it, put the lens in and irrigate, and it's all taken care of. But it allowed us to go ahead and do our job from patient care to patient care, episode to episode, instead of being trapped right there, holding the eyelids physically open to be able to irrigate them out. This is a perfect example of see one, do one, teach one. Once one person has seen how it works, they will pass the word like wildfire. Here's where this is how it goes together, this is how you do it. We had brought it to the Wabash Valley, and we've been using it in the emergency departments for years, but emergency medical services didn't have it. And so you can imagine if we've got staff to be able to give up the use of their hands to do something, it is even more difficult for emergency medical services to be able to transport somebody and take care of them. So for us to give them samples and show them how to use it was just priceless to them, because we were supplying them with Morgan lenses for a while until they ended up being able to get them themselves. It's the right tool for the right job. It actually does what you have to have done to be able to save the person's eyes. And to be able to have the right tool to do the right job, and it's comfortable, and it's functional, and it's easy, and it frees up your hands to do what you need to do for the patient while the treatment, the irrigation is still being done. That's just hardly words for it. It's just one of those ones that makes you smack your forehead and think, why did this not happen before? We really deeply appreciate good stuff and being able to do our jobs. And in my experience, emergency medical service providers work themselves to death to come along and bring us a tool that is functional, that is helpful, that reduces the patient's anxiety and pain and makes the job more functional, more useful. Bring it on. So thank you.